everyone, this is Dr. Monica Bonakdar, the founder of Bonakdar Institute and the innovator of the AMPLIPHI Filler Treatment. And this is Dee, our patient model. And for a while now, Dee has been ready for a facelift, and she's changed her mind and she wants to do a full face rejuvenation with the AMPLIPHI Filler Treatment. And Dee, thank you so much for being here and sharing your journey with the community that watches my videos, who is in your same age range and kind of having the same challenges. So welcome.
Thank you.
So what I'd like to start with is the aging process. Even though every face is unique, there are certain elements of aging that are consistent. And what's interesting is that many of those changes can be reversed with office-based solutions without the need for surgery. AMPLIPHI is my exclusive filler technique that addresses sinking, sagging, and wrinkling changes that accompany an aging face. AMPLIPHI is ideal for anyone who's looking to the non-surgical arena for becoming a younger version of themselves. So this is where we're going to get started. Dee and I have chatted off the camera, and I'd like to share with you what we've decided to do. So I usually divide up the face into 3 parts: the upper, the middle, and the lower. And the first question that I ask myself, and I also ask the patient, is which part do you think you're having more challenges with? The top, upper face, the mid face, or the lower face?
Mid and lower.
Perfect. So we both agree there. When you look at your mid face, what have you noticed?
That I have the sagging here and the folds.
Perfect. Okay. So even though Dee may not know exactly why this has happened, she's explaining her aging process to me. She has lost soft tissue and bone in her cheek area, the lid cheek junction, and it's made this what we call a festoon or a line in the mid face. Look at what happens when I replace the filler or the volume with filler in the mid face. It takes away that festoon and it softens the lower face. So one of the things that I will do is decide, do I start in the upper, middle, or lower face? And for Dee, I think I'm going to start in the mid face because that will actually correct some of the problems in the lower face before we even inject that area. So I'm going to draw out the areas that I'm going to correct, very much like how a dressmaker makes a pattern before they cut into their very expensive fabric. And these are lines that I will use as guidelines for correcting the cheek and the lid area. So my goal is to do this. Then we're going to move down to the mid face, to the lower face, and correct the smile line, this marionette line, and a little bit of hydration around the lip. So thank you again for being our model. There are many people that are kind of frozen in action and they don't see, or they don't like what they see in the mirror, but they don't know what to do about it and they don't want to make a mistake. So I'm going to show you how easy it is to get rid of some of these changes. With Caucasian faces, we lose our soft tissue in the periphery of the face. So when we lose our soft tissue in front of the ear, this is what happens, this marionette line or jowling. So Dee has a clean face, all the makeup has been washed, and we are applying what I call the germ killer to kill off any remaining bacteria. I'm hyper vigilant because I want to make sure that we have the best recovery and the shortest recovery. So here's my little germ killer. And we are going to start with the deep injections. So currently there are 5 Juvederms on the market, and each one of them has different characteristics. I use the combination of all 5 of them, and I've kind of made a map of what we're going to do. And we'll zoom on this, but I'm going to correct the lid cheek junction, the cheeks, this periphery around the ear and the jawline, the smile line, and the marionette line, and hydrate the lips. So everyone with an AMPLIPHI gets a map of what they're going to have done. Here you go. Are you ready?
Mm-hmm.
And here's our first injection. What you see me do now is draw back. I want to make sure that I am in the anatomically correct area and not in a vessel. And what I'm using right now is Voluma, which is a 2-year filler approved for the mid-face. And these are deep injections right on the cheekbone. Okay, smile real big for me and relax. So this is where her deficit is, and that's what we're filling. Okay, so now we are ready to do this lid cheek junction, and I do that with what's called a cannula, which is not a sharp needle, so that when it hits vessels, it goes above it or below it, it doesn't pierce. The other way I avoid bruising is that I use what's called a vein finder, and it actually shows me where the major vessels are, and so I try and avoid them. So Dee, the first shot is just a little bit of numbing. So we want this area to really blend with the cheek and have it be one connected unit, because this is the telltale sign of a face who has aged and a face that looks rejuvenated and refreshed. And Dee's skin, even though it is on the thin side because she's had fillers in the past, has pretty good collagen, so it's resisting my cannula. But we numbed her before we started filming, so how are you doing, Dee?
Okay.
Perfect. All right. So that's our mid-cheek correction. So we're now ready for the lower face, and I'm going to start with the smile lines. And here's my ACCUVEIN again. This is a sensitive area, so even with numbing, I'm not surprised that you have a little bit of sensation left. Mm-hmm. Yeah. Okay, very good. So this is my trick for getting rid of the gel that is forming. It's working. Some people don't bruise at all, and some people already know themselves and are very prone to bruising, and for those people I suggest that we start with arnica before the treatment day, which is a homeopathic medication. It's a plant that grows in the Alps, and it helps to prevent and heal bruising. Wow, different person. That's actually a common mistake among some injectors, is that they'll put the same amount on both sides, but you really have to assess the face and see how the two sides have aged. We don't start out with the two sides as mirror images, but the closer I can get it to be mirror images when we're finished, the more beautiful and proportional someone's gonna look. This is the part that I'm doing with the cannula. This is a little bit of numbing. Then comes my port opener. And here comes the actual cannula. Okay. A little bit of tugging, sorry. D, you're making it look really easy to be a patient.
It sure feels comfortable.
Mm-hmm. Okay, and don't smile. That looks amazing. So I've done as much as I can with the cannula, and this is just the finishing touches that I need to do with a needle, but we're using our ACCUVEIN vein finder. Okay, right here. So the way it works in my practice is that we always start with a consultation. We start with clinical photography, and then it's an interview between myself and the patient in order to come up with a plan of action for our treatment day. I have patients that need to do one sitting and get all their fillers done, and I have patients that want to break it up. Usually the ones that want to have it done together are people that are going to take time off work, and so they want to have one downtime, whereas those that are going to continue working want to break it up into several different sessions so that no one will find out, and that if there is downtime that it's more manageable. So what made you decide to do your whole entire treatment together?
I think it's better to do it all at once and have one recovery time. I did take a week off from work.
Perfect. And so a week off for someone who already knows she's a bruiser is a good amount of time. I have plenty of people that do treatments with me and don't bruise, but we have to be realistic and know ahead of time who is going to need that extra recovery. We'd like to say at Bonakdar Institute that we like to under-promise and over-deliver. Okay. Oftentimes as I'm injecting, I will kind of step back and admire my own work and say, wow. Sometimes that scares the patients, but Dee's worked with me before, so she knows it's a good wow. Okay. Love it. Okay, so I'm done with the mid face and the lower face, and I've stepped back and taken a look, and I see that I'm still a little bit hollow here on the right side, and so that's the finishing touch, and we're going to be done after that. Oh, I take that back. We're going to do lip hydration. So I have a lot of people that have lost volume in their lips have shriveled up. It happens with everyone with age, and the very first thing everybody tells me is that they don't want their lips big, and that's why we now have a great product specifically for lip hydration called Juvederm Volbella, and it's very, very light. Okay. In my assistant's hand is a micro vibrator, and the vibrations on the skin actually reach the brain before the pain sensation from the injection reaches the skin or reaches the brain, and therefore it fools the brain, and you don't feel the injections. Okay, perfect. Now we gotta hold.
That works.
It works, huh?
Mm-hmm. So the hydration, does that mean you're doing the lip line?
Yeah, so that when you put your lipstick on. It doesn't travel outside it. It will swell tomorrow for a little bit, but first of all, these are half syringes that they give us because they wanted us to really get in touch with the characteristic of this product. It doesn't need a whole lot for it to do its thing, and it just gets, and whoever I do like one syringe on, they always come back and say, can I have a little bit more? So that's how light it is, but I love it because everyone worries about that, you know, ducky lip look. Okay, remember.
See, it's kind of like half there.
Sorry, that was a bit sensitive, but you did.
It's not
you
like Peter. He was like,
Need another one of these?
one more?
Yeah. Okay. So let me have that. I'm building your Cupid's bow. So thank you for watching. Here is the mirror. I want you to take a look, and what do you think?
Wow.
You're a wow, huh? I agree.
Big difference.
Good, good. Well, thank you, Dee, for being our model. For all of you at home who want to learn more about the AmpliPhi treatment, you can request our digital brochure by following the instructions in the caption. Thank you.